Hello, good afternoon, everyone. Welcome to the City of Alameda Mayor's Town Hall. I'm Sarah Henry, the city's Public Information Officer. Today, the mayor and I are here to talk about the COVID-19 vaccine. Please note that all Zoom participants have been muted. If you'd like to submit a question, please use the chat feature. And all of our town halls, including this one, are recorded and available on the city's website and on our YouTube channel. So I'd like to turn today's town hall over to Mayor Marilyn Ezzy Ashcraft.
Thank you, Sarah, and hello, everyone. Apologies for starting a little late. We were having some technical difficulties, but we're here now, and Sarah, Henry, and I want to just walk you through an update on where we are in Alameda County, in the city of Alameda, getting people vaccinated for COVID-19. And for those of you who are eligible or will soon be eligible, we want to show you how easy, in air quotes, it can be to register. Actually, you just need to know some key information, and Sarah has put together a wonderful slide deck that is going to help walk you through whether you have access to a computer. I mean, I guess if you're watching us today, you are connected to the internet and have bridged the digital divide, but we know that not everyone has. So perhaps you know someone, a friend, a neighbor, a family member who's really having a hard time getting being able to register to get their vaccine. And we want to tell you how that can be done. Just yesterday, Sarah helped a resident, one of our Alameda residents, a woman in her 70s, who called and left me a very frustrated email. I want to get vaccinated. I don't know what to do. And Sarah was able to get her registered for her appointment, and we want to help you too. So we want to start this presentation, and then we want to take your questions. And the ultimate goal is we're going to get every last one of you vaccinated, not all at once, but in good time. So Sarah, shall we start the slides?
Yep, let me try this. I've never done this before from here, but let me try.
You can all be our guinea pigs.
Okay, how does
I
that?
can see it. Hopefully others can too.
Is it big or is it small?
It's big. We can see the slides on the side too, but that's okay.
Okay, that's okay. Okay, this is easier for me if this works for all of you.
It does.
Great. Okay, so let's get started. So Mayor, would you like to kick us off?
Sure. So we are now in what is called phase 1B of for the vaccinations. You don't really need to memorize numbers. What you need to know is what we're about to tell you. First off, who is eligible now? Shall we go to our, keep scrolling to our fun photo page?
Oh, sure.
Okay, this is just a little overview. You might recognize that person up in the corner. That was me getting my first vaccine earlier this month, Valentine's Day, as I recall, at a CVS location. And we see also on the screen that right across the Park Street Bridge, or one of our bridges, High Street probably is closer, is the Oakland Coliseum that the federal government and FEMA have set up as a megapod point of distribution. Lots of our residents and residents in Alameda County are getting their vaccinations there. They're administering as many as 6,000 vaccines a day, 7 days a week. So if you're eligible, we want to get you onto the list. And yes, you see that our healthcare workers were in the first tier of priority because they are such important essential workers. They've been keeping us safe throughout this pandemic. And so they were certainly in the first tier to get vaccinated. So then scrolling on down to the next slide,
Mayor, the beautiful photo with the rainbow, that it's hard to see, but that's at the fairgrounds. That's
at Pleasanton, the Alameda County Fairgrounds, which is a location you'll hear about a little later in the presentation, where they're vaccinating, among others, those 65 and older. So this just gives you the information about who makes the decisions about where vaccine sites are located, who's getting vaccinated, how much vaccine is distributed. The short answer is the mayor has very little to do, actually nothing to do with this. My job has been to try to disseminate information so you know where you can go to get vaccinated. So and one of the reasons we don't have a lot of opportunities in Alameda to get vaccinated, I mean, you might have been lucky enough to get an appointment at one of our CVS retail pharmacies in Alameda, perhaps at Kaiser, but by and large, looking at the county as a whole, our COVID numbers have been very decent. That is to say, low per capita wise. So the county wisely and the state are trying to get those who live in the most hard hit areas of our county vaccinated first. That's going to help bring our case rate down for everyone. And of course, folks who work in these important professions that we're working to get vaccinated. So yes, the federal government, state and county all have a role to play. Okay. So I and city staff, our assistant city manager, Jerry Bowden, and I are the co-chairs of the mayor's COVID-19 vaccine task force. We have, I think, 15 members now that represent a lot of different sectors of our community that we want to make sure are getting their vaccinations, are getting help if they need it. And our representatives, we have a medical doctor who actually is in charge of the vaccination effort for Alameda healthcare systems. That's Alameda, Highland, San Leandro Hospital, and others. We have a pharmacist. We have representatives from Alameda Unified School District, a representative from one of our long-term care facilities, from the business community, from Meals on Wheels, from the Housing Authority, Center for Independent Living, which works with people with disabilities, and Dr. Cindy Acker, who's been very successfully had her child's unique Montessori school K through 8 up and running since September, meeting all the state guidelines. And there's a few others, and we're working hard to make sure that first our most vulnerable population, our seniors, are getting the word that they're eligible to be vaccinated, how to register for your appointment, and even helping them get transportation to their appointments if they need it. And yes, that's our mission. We're going to get all Alamedans vaccinated as quickly as possible. So who is eligible now? We have it, hopefully, and I think we have gotten most healthcare workers who are willing to get vaccinated. They have gotten their vaccines. They were first in the line, absolutely rightly so. And also people in long-term care facilities and staff who work there. I'm really proud to say that in the city of Alameda, our residents and staff in these long-term care facilities have had both their first and second doses of the vaccine. And this was through a partnership with CVS Pharmacies. The pharmacists went in to the homes and gave the vaccinations to the residents and staff. That's a big success story. We're working now on getting people 65 years of age and older vaccinated. Also, importantly, I'm just going to jump to the bottom of that list, our education and childcare workers, so our teachers. We so want our kids to be back in school. The teachers want to be back in school. They'd like vaccinations. And so in our county, we opened up on February 16th when that big site at the Oakland Coliseum opened. They had started their registration a couple days before, and every day since then, starting on the 16th, teachers and school staff and childcare workers have been getting their vaccinations there, and other locations too. But the Coliseum site, it's very efficient. It's all drive-through. I've heard reports from folks who have gotten their vaccinations there that the staff are so nice, and that's wonderful. It's just as it should be. And also food and agriculture workers, and that includes the grocery store clerks who have been front-facing essential workers from the beginning, restaurant workers, the food servers if it's outdoor dining, cooks, and people who are just processing our food and harvesting our food, our farm workers. So it's very important that they get vaccinated. And also our emergency services workers, so police and firefighters. We've already gotten the EMTs and the paramedics from the fire department vaccinated. And I understand about 100% of them in Alameda are vaccinated. So that's great. And then, yes, good information about how they're prioritizing folks within these categories. So far, knock on wood, we've been very fortunate that the Coliseum site has had constant supply, and they are scheduling vaccines. And earlier this week, I got a notification that people 65 years and older who are Alameda County residents could get vaccines at the Alameda County Fairgrounds, and there was a way to sign up to do that. So this is good news. And then, yes, starting in a couple of weeks, the governor has ordered that people between the ages of 16 and 64, so they didn't fit into the 65 and older category, but of these ages, if you have one or more of these health conditions, which makes you more vulnerable, susceptible to extreme reaction to COVID-19, then you will be able to register and get your appointment to be vaccinated. So let's talk about where you can get vaccinated. And we're going to go right into the next slide. So how to sign up? Yes, I would say if you have a healthcare provider, if you get your healthcare through Kaiser Permanente or Sutter or Stanford Health Systems, or another one that I haven't listed, check with them first. Call them, check the website. If you're able to sign up to get notifications, do that. Get yourself in the queue. And later in this presentation, you will see a list of all the contact information for these different major healthcare providers. And then a really good option that you should all do is to sign up with the state of California through My Turn, all run together, myturn.ca.gov. And that gets you into the state's database. You'll be asked for some information like your zip code, your age, there's a drop-down menu for your employment category to see where you fit in the hierarchy. And then once you're in the system, and you'll probably get, I think, a text message going back to you confirming that you're in the system now, you will get periodic updates. Okay, there's vaccines available for your eligibility category at these locations. You cannot schedule your appointment through myturn.ca.gov, but it will take you to a link to a provider or whatever the source is where you can register. So be sure to do that. And if you or someone you know doesn't have access to the internet, there is a phone number. And I want you to know that all the phone numbers that are listed on the coming slides, I sat down and called every last one of them and talked to people to make sure that this was good information. And the folks at the California COVID-19 hotline where you would call to make an appointment if you can't do it online, they were lovely, and they'll help you too. Okay. Oh, and then just, yes. So the other things are the county is a good place to register. And oh, and Sarah just informed me, Sarah Henry, who's always several steps ahead of me and really stays on top of this, said that the state has recently changed their system so you could do one-stop shopping. You can schedule your appointments on My Turn. So apparently, Sarah, is it when you're notified that you're eligible, then
Right. Or if you're eligible and you go on to just to sign up, if you are eligible, the next step would be to go ahead and schedule your appointment. And then they ask for
Awesome.
your zip code, and then they put you in touch with the closest places.
Right. Yeah, and that is a good reminder. Don't just show up at a site and say, I want to get vaccinated. There are very few walk-up locations right now. So the most efficient and effective is to sign up for your appointment, be there on time, even a little bit early, and then just go from there. And generally speaking, you are able to schedule your first and second appointment when you schedule your first appointment, but be sure to do that. You want to be sure to schedule your second appointment as well. And then the county, we also have a site where you can check with the county, and they message out when sites that they've set up have availability for your category, and you can schedule your appointment through them. And then finally, pharmacies. Right now, CVS is accepting appointments for to get vaccination at a CVS pharmacy. We understand that soon, sometime soon, Safeway retail pharmacies will as well. It hasn't opened, as best I can tell, it hasn't opened for the general public yet. It could be that healthcare providers may have a special way to access Safeway's online sign up, but it hasn't happened yet, to the best of my knowledge, for the general public. So then is the information. And Sarah, how can people who don't have speed reading and speed writing abilities, how could they get hold of this information?
Sure. Well, all of this is up on the city's website. So if you go to alamedaca.gov/vaccine, all of this information is right there for folks.
Just like that. So this just takes you through Kaiser Permanente, a phone number or their website. And when I called you, I don't remember them saying that there were hours of operation, but you did need to, before you went further in the phone system, you needed to punch in your member number or patient number, which I'm not a Kaiser member, so I didn't have that. So that was as far as I got, but I know that phone number will take you there. Stanford Healthcare has certain hours of operation. Sutter is very convenient. They operate hours Monday through Friday and on the weekend to call or make your appointment. Well, you could make your appointment online anytime, but to call those hours. And I also want to just make a request that if, say, you were to go and schedule yourself at a couple different sites, but say you scheduled at one and then, the county emailed or texted you and said, you could get vaccinated sooner here. Well, you're going to get vaccinated sooner rather than later, aren't you? That's fine, but please do the ethical thing. The minute that shot is in your arm, your first vaccine, go back to the appointment you scheduled earlier and cancel it so that someone else can get that vaccine. So just a nice thing to do. You want someone to do that for you. And again, here's the California COVID-19 hotline, also with hours of operation, answering the phone 7 days a week. And there is the website information. Then you don't get to choose where you go. They'll tell you next available is here. And as I like to say, when someone offers you the opportunity to get vaccinated, please take it. Okay. And so you can, Sarah, do you want to talk a little bit about the county appointments?
Sure. Well, I have the experience yesterday when I was helping this lovely woman from Alameda sign up. So when you go online to get notified to see if it's your turn, it's the covid-19.acgov.org/vaccine. So you fill out that form, and then once it is your turn, there's another link, which is a longer link. So we have that up on the website where you can actually register. So Alameda County residents who are 65 and over can register to go get their vaccine right now at the Alameda Fairgrounds. And just yesterday, when I worked with this woman, we got her an appointment today. So their appointments are available.
Yay!
and like you said, Mayor, we got her first appointment scheduled and her second all in one place. And you always have to go back to the site that you got your original vaccine at. So if you do go on to these sites to register to get notified, if let's say you went to go get an appointment at the fairgrounds, when the appointments are no longer available, there's an opportunity for you to sign up for the wait list. And it's really important that you do so because they won't come back to you unless you add yourself to that wait list. So it's really important when you go onto this primary bio site that if there's no appointments available, hang in there, add yourself to the wait list, and then probably the next day something will open right up.
And thank you for pointing out that hang in there advice. As I said in the newspaper article that I wrote, let's see, it'll be in the Sun this week, in the Journal next week, but it does take perseverance. It does take patience. It is easy to get frustrated, but just hang in there or ask someone to help you if you're really having a hard time. But the good news is more vaccine supply keeps coming in. There was last week was kind of challenging, not for too much for the Alameda County sites, but you may have read that Moscone Center in San Francisco had to shut down for a week because that bad storm on the East Coast was impacting shipment of vaccines that were coming from the East Coast. So but again, people are getting they're getting their vaccines every day. So vaccine appointments every day and vaccines every day. So you can too. And again, the CVS pharmacy, try at different times of the day. I think sometimes it helps to try early in the morning, try the phone line, be online trying to log in and be on the phone too, and just see which one comes up first. It takes a little strategy, but
Even
it's
even
doable.
for even for my turn, I had heard that they released the appointments at 8:30 or 9 one morning, and then the next day they were releasing it at noon. So I don't think they're, I think it's every day it's a different time. So
Yeah.
you have to just keep refreshing.
Right. Don't get discouraged. That's what I
No.
would say. Okay. What's next? Yes, I want to tell you about this is an important tool. If you have a smartphone, vSafe at vsafe.cdc.gov, so the Centers for Disease Control and Prevention, are using this great text message system to check in on you after your vaccine. So you will get for the first week after you're vaccinated a text message from them, and with easy to answer questions and little graphics of, are you feeling symptoms? Would you describe them as mild, moderate, severe? And then more specific, you can choose symptoms, or you could even type in if there's something that's not on the menu. And then if you actually are having kind of severe symptoms, side effects, which is very rare, you will actually get a call from someone from the CDC checking on you, and they may check in more frequently, advise you to see your healthcare provider. But this is a way that the CDC is getting more information about all the different side effects of the vaccines, because there's a place where you put in which one you had, and so they know, and that just helps them improve their data, and they share that information with the manufacturers. And eventually there may be booster shots that are coming out of Moderna and Pfizer now that we know that these more um, serious, more contagious variants of the virus are out there. So do register for vSafe, and then we'll go into the data dashboard first. But I also wanted to say that, so when you are vaccinated, you will get this vaccine card, your vaccination record card. I read a good tip that I want to pass on to you, which is take a photograph of that card, the front and the back, uh, and and store it on your phone, or at the very least take a photocopy of it. But just in case you misplace it, the dog eats it, it whatever, you want to have that record, to be able to take to your next vaccine. And who knows, you may be showing it to book a plane flight one of these days. I think they're talking about something similar in the EU, but in electronic form. So let's talk about the numbers. Sarah, what do our numbers tell us?
Great. So we put these numbers all up on our website. We track the city numbers, the county numbers, the state numbers, the country numbers, and the world's numbers. But here in Alameda, we have 2,202 cases, and that's over the last year. That's for the duration. We've had, sadly, 71 deaths here in the city of Alameda. Thankfully, the past couple of weeks, we haven't seen any new deaths, which it was rough for a while there. Alameda County, a little bit over 80,000 cases. So as many people have COVID-19 in the county that are in the city of Alameda, and over 1,200 deaths. And then of course in the state, we have almost 3.5 million cases. And then you saw the news recently with we've now reached over 50,000 deaths here in the state.
And of course, nationwide, over half a
Over half a
million.
million, yeah.
Yeah. But what's the good news, Sarah?
Yeah. So when we look at the dashboard, which we do all the time, we can see that the hospitalizations, that those are decreasing, which is wonderful to see. And then we see the inverse, which is that the vaccinations are increasing, which is also great to see. Countywide, about 49% of adults who are 65 and older have received at least one dose. That's wonderful. And then here in Alameda, just this morning we checked, and it was 23.6% of our population 16 and older have received their first dose. And quite a lot of people have received their second dose as well, are fully vaccinated here in the city of Alameda. So very good news. And this is just a quick look at what the vaccination data, the dashboard looks like on the county's website. So you can see the doses administered by day, by city, how many people have received their first dose and second dose, and then just all of their county's total numbers. You can see the breakdown by age group, by race and ethnicity. And then this next one is the same one, but I pressed this see percentages number button here. So all of a sudden the totals went to percentages. So here you can see that 7.7% in Alameda are fully vaccinated.
And Sarah, this information is available. Is it on the county's website?
Yep. This is at acphd.org, the Alameda County Public Health Department.org. And then you just have to click the button that goes to the COVID-19 data dashboard. And then of course we have links all over our website as well to this information.
So because I guess mayors are a little competitive, or at least I am. I really like seeing that Alameda, almost 24%. And that was like at close of day yesterday, Sarah, right?
I took it this morning, this screenshot.
Yeah, but I mean the data. I would
right.
imagine.
I'm sure it's probably a couple days old, actually. Yeah.
A couple days. Okay, but anyway, it's probably closer to 25% of our population is vaccinated now, which is outstanding. I get concerned when some of the cities, like I know Hayward has the highest per capita COVID rate in the county, and yet their numbers they aren't up where we are on first vaccination. So hopefully they'll be able to turn that around, because we really just need everybody to get vaccinated when they're eligible. And it could be that they have a younger population that hasn't come up as eligible yet. So anyway, good information. What's next? Yes. Okay. So, and this is what does need to be messaged out. Although I always say I think Alameda residents are doing a very decent job at following county public health and state guidelines and Dr. Fauci's advice. So now the county is calling it the 5 W's: how we stay safer by wearing our mask, washing hands frequently, watching your distance. You know the drill: 6 feet away from anyone who doesn't live in the same household with you. Wait to see your loved ones. We're all excited to get to see grandparents and grandchildren again, but wait, I think, until you've been vaccinated, they've been vaccinated. And when it's your turn, get vaccinated. And here's information again up on our website where you can go to get more information, because it changes all the time. And with that,
I will stop sharing.
We'll stop talking and listen to you. So do we have any questions, Sarah, from the audience so far?
A couple questions. So somebody asked, they just asked a clarifying question that I answered in the chat, but they asked just to clarify, you can only schedule an appointment through My Turn if your tier is now active, and that is correct. So you get the thing that says, yes, you're eligible, and then here's the next step.
Yeah.
And then somebody asked if there are ways for people without medical experience to volunteer to help with the vaccination effort. And I do think that the county was looking for folks to help with this. So I would definitely recommend folks go to the county's website.
I do think you're right, Sarah, that there is somewhere on there, and you could probably even type into the search box where you can volunteer to help with this effort. And I would imagine that would be after you get vaccinated, but it's also so heartwarming and so typically Alamedan to say, how can I help? And I love that. And I will say, eventually, we do hope to get either a pop-up vaccine clinic or a mobile clinic, a van. There's some vans that are especially outfitted with the refrigeration unit needed to keep the vaccines at the required temperature and all that. We expect to get some in Alameda. So then we probably would start with like our CERT volunteers and others, but definitely we'll put the word out if we need help. What I would say you could do just for the effort, just think about, and it doesn't have to be in the city of Alameda, but do you have a relative? Do you have a friend or a neighbor that you think, they might be having a hard time accessing a vaccine information, scheduling an appointment, or maybe they schedule, but they need somebody to take them there. And so reach out and see if you can lend a helping hand. I mean, a lot of our seniors are fortunate they have family members in the area, somebody they stay connected with, but they don't all. And I have to say, it's part of the reason I started the Mayor's Vaccine Task Force is I was getting voicemails from individuals in their 80s saying, Mayor, I want to get my vaccine. I just don't know how. And their tier, I mean, we started with people 75 and above, and by now, every last one of them should have had their vaccines, but we also know that they tend to be in the category that is most impacted by the digital divide. So we don't want that stopping someone from getting these vaccines. So reach out and see if you can think of anybody who might need your help, and then you've got lots of good resources to apply to that effort.
Yeah. And then
Yeah,
just one,
Sarah?
just one last question, unless folks want to continue to add. The next person said, are there special authorization codes? Are they being used in order to schedule?
Such a good question. I did hear on the news this morning, I think it was KQED FM, that the governor, you might have heard, is now setting aside like 10% of vaccine allocations for teachers and teachers in certain areas that are either gone back to school or they've been hardest hit. I think our teachers are doing a really decent job of getting themselves vaccinated here, but I believe they also said, Sarah, did you hear this, that you would get a code that you could type in. So in the My Turn, when you go to the myturn.ca.gov site, you will see as you scroll down at the bottom, it's kind of like when you're ordering online and they ask if you have a promo code. And you'll see that. And so there has been, you may have heard this in the news too, a little bit of abuse of that. Somehow folks who shouldn't have been getting it, the code was able to be copied in a text message and forwarded to others, and people were using it. People who were definitely not in any of the eligibility categories were able to get it to schedule their vaccines. So I think they may have made some modifications to the code. But as I recall, and Sarah, you can confirm or correct, but that if you get, I think that there's a way that teachers are able to go in, and I see that
And
on the
other groups. Oh, yes, Susan. Yes.
we've got the Susan, you never know when you're going to get called on when you're in my my meetings, but we've got the wonderful Susan Davis, who's the public information officer for Alameda Unified School District. Susan, what, if anything, do you know about special codes for teachers or anything else that might be helpful for the audience to hear?
From my understanding, it's been a little bit confusing, but we're looking at different tracks for getting our staff vaccinated. One is through the feds, through the FEMA site at the Coliseum, and they are not providing us with access codes.
No.
I have seen that that same field on their form, and I'm not sure who gets to fill in that code, but they're not giving it to teachers. But the county, when they start ramping up for educators at the fairgrounds, they are going to be providing some kind of like unique appointment code or something. But
Got it.
Completely agree with you, Mayor Ashcraft, that our teachers have done a really, really good job of going out and getting the vaccinations. And we've been trying to help them understand where and how to get them as we can.
Yeah. No, I see them on social media. I love it when they post and share and all that, which is wonderful. But we just want to make sure that anybody who's having a hard time gets over the hurdle. So Susan, did you have any sense of when the county might be providing those codes?
Well, I think right now the fairgrounds are only open to age 65 and older.
And older.
Yeah, I
Good
think
point.
that I think that what I heard yesterday, and honestly, it kind of changes every day, is that
It changes by the minute, Susan.
we're actually careful about what we say, but I'm pretty sure that the current plan is that on Monday, there's going to be something like 300 doses available per day for educators. What we don't yet know is what they need to bring to prove that they're educators, or, those kind of details, but they're getting there. They're getting there. It's a big effort to organize.
I
So
think the codes for the My Turn site, my understanding is that those codes are specifically for like disadvantaged communities or
that
by zip
might
codes
be
and whatnot. So I
okay.
think that's
Okay.
how they're being used for now. And then great that they have the technology for the
And
future.
and good point, Sarah. And that's 100% appropriate. And it is one of the reasons that the federal government, FEMA, decided to locate this site at the Oakland Coliseum, because this area is surrounded by zip codes that have been hardest hit by COVID-19. And so we want to make it easy for people to walk up, to get there by AC Transit, to get there by BART. And certainly Alameda residents can go over the bridge, but we're very grateful that that's where it's located. But I think we all understand waiting in your turn to just make sure that those most impacted get vaccinated. So good. And again, as more of those zip codes do get their vaccinations, and as the supply continues to increase, more people will probably move the codes down a bit. But I will just give you a little spoiler alert, Alameda, 94501 and 94502, we're nowhere near high impact zip codes. So, but again, there's many ways to get registered, and teachers should not feel they have to wait until the county fairgrounds site opens up for teachers. Do what you can to get yourself vaccinated now.
That was the last question that I had from our guests.
Okay. Well, again, thank you so much, Alameda, for doing what you're doing. Just remember that we do have to keep wearing those masks when we're outside. I'm even double masking now. Dr. Fauci says it's a good idea because these new variants, these are little tiny particles. So what you do is you just take that surgical mask, the blue outer facing, you want white next to your face, put that on first, then you put your cloth mask, ideally with the wire over the nose, and you fit them down so that you just don't have air gaps and all that. And you can still breathe, but it's just protecting you from any particles out there, and it's protecting others in case you're carrying them. But when you stop and think about where we were just a year ago, I mean, a year ago, as the city manager and I often say, we didn't know what we didn't know. We knew that there was this something coming from China. Someone in the state of Washington had been diagnosed with it. I think later we found out that the first case and death really was in Santa Clara County. And then there was that cruise ship, the poor passengers and crew. They were off the coast of California, and nobody wanted to let them come to their port. And eventually they did in early March. So not even a year ago. And then at our county and the other Bay Area counties were the first in the nation to impose a stay-at-home order. And we did that starting on, I think, St. Patrick's Day last year. And so from the first case being detected in California, I guess in the country even, in January of last year, then in December of last year, not one but two vaccine manufacturers, Pfizer and Moderna, had gotten their emergency use authorization from the FDA, and they were already ramping up and ready to just churn out those vaccines. I think they'd already started manufacturing, because you can't, get your distribution up and running that fast. And then today sometime, and I don't know whether the news has already come out, but Johnson & Johnson is being considered by this panel of the Food and Drug Administration. And from everything thing we're hearing, it's going to get its emergency use authorization. You might have heard that their efficacy numbers don't look quite as high as Pfizer's and Moderna's, but the important thing to remember is Johnson & Johnson's vaccine has now been tested against these new variants. And so to show that it's 85% effective at keeping you from getting seriously ill or dying from COVID, that's nothing to sneeze about, really bad pun. And that's going to be a game changer. I know I've heard folks at County Public Health say they want to make sure that all of our hospitals have a supply of that so that anyone who comes into the emergency room, especially in any of these vulnerable categories, gets that shot. It's a game changer for our unsheltered population. If we can do a mobile clinic going out to where there are encampments, people just need one vaccine, don't need to track them down to get their second shot. And it's just a third vaccine in the supply chain. So it is getting better. And we're going to get there. And we've gotten this far because of all of you. I can't make every last one of you go out and get registered, but look at it. I would venture to guess 25% of our population has gotten vaccinated to date. And that's even with the relatively limited eligibility we have to date. So, and again, help me message this out because I'm not sure that all grocery store workers or restaurant workers necessarily know you're eligible. Go online and register for your vaccine, and anybody who works in childcare or education, get registered. And of course, our 65 and older population. So, Susan, Sarah, anything to add?
Nope, just to say that timeline, that January to December, Dr. Fauci says is a medical miracle. So I always like that alliteration. And yeah, and it is,
Yeah.
it's a miracle.
It is. And, you know, years from now, we'll look back on this, but we are truly living through a moment in history, and we're gonna prevail. So just keep doing what you're doing. And oh, and I want to tell you about our town hall next week. Sarah, do you want to, because Sarah's the one who makes these things happen. I just come up with ideas and then throw them at her, and she goes, okay. So who have we got lined up for next
Well,
Friday?
we're thrilled that our state senator, Nancy Skinner, is going to be joining us next Friday at noon, same time, same place. And we look forward to hearing all about what the state is doing to help our residents with COVID-19. So all of the state programs, financial support, other supports for businesses. We can't wait to hear more.
This new Golden State relief package that the legislature recently passed. So this has implications for families, for small businesses. So tune in and learn more about it firsthand. I think Senator Skinner is the head of the Senate Budget Committee now, and she is just a dynamo. We are lucky. We're very blessed in our city, in our assembly district, our Senate district, our congressional district. We've got just amazing leadership. So tune in and hear from our state senator. Bring your questions to ask her. Thanks for joining me today. And this recording will be available on the city's website for anyone who wasn't able to join us. And thank you so much. Thanks, Susan. Thanks, Sarah. Thank you all. Take care. Stay safe.
Bye, everyone.
See you next week. Bye.